I'm falling for Las Vegas, where the lights they shine so bright. I'm falling for Las Vegas, more than a sip, it's a way of life. I'm falling for Las Vegas, not one dream is out of sight. It's so plain to see, she's been good to me. Oh, my lovely Las Vegas tonight.
Guys, well, thank you. With news today that both the deaths of Casey Johnson and Brittany Murphy could have been prevented, many are wondering what went wrong. If the women sought medical attention and followed doctor's orders, they could possibly still be with us today. Joining me now with some insight into these tragedies is Dr. Paul Oesterman. And, doctor, thank you so much for being with us, because both these girls were young, reasonably healthy, and now finding out with the coroner's findings today, this didn't need to happen.
Right, it's so true. These are both very tragic occurrences. For instance, the case of diabetes.
Okay.
Diabetes, traditionally, many years ago, was deemed to be a death sentence. That's no longer the case. Through basic, simple steps of blood sugar monitoring, proper diet, proper exercise, taking the medication, patients with diabetes have no reason to experience any of those unwanted or undesirable side effects that can ultimately result in death.
All of which it seems like Casey Johnson apparently was not doing. They say she wasn't taking her insulin, was not on her diet regimen, was just basically not following doctor's orders.
Exactly. It's so simple for these patients to check their blood sugars on a regular basis. If they see anything untoward, check back with their physician so that they can be properly treated.
Okay. With Brittany Murphy, so that's a little more confusing, because she didn't have, a chronic condition like diabetes, but she did die of pneumonia, and there's all these prescription drugs that were in her system apparently.
Right. With her case, unfortunately, she had a number of different prescription and over-the-counter medications, and my feeling is that unfortunately we don't have a toxicology report back yet to determine the actual levels of these medications, but the combination of these contributed to her pneumonia and unfortunately her tragic death. And what we're seeing, for example, in the Las Vegas Valley, is a number of people who take their medications, they feel better, and then they have the medications left, and they don't know what to do with their leftover medications. Fortunately, there's a coalition here of the School of Pharmacy at the University of Southern Nevada, Metro Police, the Coroner's Office, and the Southern Nevada Water Authority that are working together to have an Operation Medicine Cabinet Take-Back Day on February the 20th.
Oh, really? So basically, if you have leftover medicine, you need to get this out of your cupboards, because maybe your child, another friend will mistakenly take this, and it can cause some, some fatal interactions possibly.
Very true. We have had reports of this occurring here in the Las Vegas Valley, where some of the teenagers, what they do is they'll get together and have what they call a farm party. They'll steal a few tablets, capsules from grandma